A medical breakthrough is making a way for some patients to avoid open heart surgery. Here with the details, Dr. Nadim Geloo, who's along with Gregory, a heart patient, Vietnam veteran, and patient advocate. We thank you for your service, and we thank you both for being here. Doctor, leaky valves are a very serious situation. What is a leaky heart valve, and what are some of the symptoms?
Good morning, Angela. Thank you for having us. A leaky heart valve is when the one-way heart valves are not sealing properly and they allow blood to leak backwards. Unfortunately, this can lead to a great many symptoms for patients, and these symptoms can be something that affects their quality of life and can include swelling in the legs, particularly if it's the tricuspid valve on the right side of the heart, swelling in the abdomen, loss of appetite, loss of energy, and just not wanting to do or being able to do everyday activities and the activities that brings one joy.
Gregory, as a former patient, please share your story.
I went to my doctor because I wasn't feeling well. I had the symptoms that Dr. Geloo was talking about. I shortness of breath, fatigued, swelling in my abdomen, and just knew that something wasn't right. So I went to my doctor. He did a series of tests, and when I went back to see him, he said that the problem I had was a tricuspid regurgitation, TR, and because of my age and my health history, he felt that it would be much too risky for me to have open heart surgery. So he said another physician that he knew was going to be doing a clinical trial using a device called the Abbott TriClip. So I was referred to Dr. Singh, and he did an evaluation, extensive evaluation. I qualified for the surgery, had the surgery that night. They inputted the tricuspid clip, what was called the Abbott TriClip, and I stayed in the hospital for one night, and then I was discharged and went home the next day.
Tell us about the recent FDA approval of the Abbott TriClip and why it is a significant advancement.
Yes, this is a revolutionary device. It's a minimally invasive procedure that's simply done through a puncture in the skin in the area where the leg meets the body. Patients can go home the very next day. In fact, after the procedure, they're up and walking later the same day. Prior to this procedure, this revolutionary device that Abbott's developed, patients were receiving diuretic therapy, which can be quite uncomfortable. You have to be near a bathroom all the time. The other therapy that could be offered to patients was open heart surgery, which is a big procedure, and many of these patients had risk factors which made them not good candidates for surgery. So if you take that sort of background, it's clear that having a minimally invasive device just can change people's lives, allowed me to go back to doing the things that they love to do.
Gregory, how are you feeling these days?
I'm back to about 85% capacity. I do all the things I normally did, golf, swim, enjoy my family, grandchildren, and just feel like I'm back to a normal position in life again.
Dr. Gregory mentioned being a candidate for a clinical trial. How can people get more information?
Certainly. Your viewers can go to Abbott.com to learn more about the Abbott TriClip device and also other cardiac devices that Abbott's developed to improve patients' quality of lives. Gregory was involved in a clinical trial which, when it was completed, led to the approval of the TriClip device by the FDA. Fortunately, no trial is required for this device now. It is available to patients who have a leaky right-sided heart valve or leaky tricuspid valve. Patients can discuss these treatment options with their physician. So I would encourage anyone that's feeling some of the same symptoms that Gregory was feeling to follow up with your physician and see if this is an appropriate device for you.
Go to businessfirstam.com for where to see our show on TV.